I'm Dr. Gireesh, physician, neurophysician and neurosurgeon, and I'll speak to you on another unusual headache, and that is cluster headache. The pain, or you can say strictly, it will be unilateral. A pain will be in and around the eye, very sharp stabbing pain or piercing or a burning pain occurring in and around the eye. And this pain will be lasting from about 15 to 180 minutes, almost really 3 days it can last. And this pain, it can be either in the eye, and the associated features of this are, you find the patient will have a conjunctival redness of the eye, then a nasal stuffiness, sometimes a running nose will also be there. And usually these attacks, these bouts last from 7 days, sometimes it may go on with the remissions up to around 1 year. Sometimes it may be 2 to 3 weeks. That is why it is occurring in clusters. Sometimes patients can go on for years without a bout. The medications that are given, again act as for any headache for that matter, get it investigated, have a detailed examination after seeing a neurologist or a neurosurgeon, and after which you see that you take medication, that is, investigate, find out an organic cause which can produce these headaches. But cluster headaches are usually idiopathic, and therefore there are medications for this like triptans. They in fact relieve the headache. You can take 4 to 6 milligrams, or you got the subcutaneous sumatriptans are available. Intranasal ones are also available. All this, of course, with the advice only of a doctor, you can actually take. 100% oxygen inhalation is in fact also effective for this, and sometimes a short course of steroids can in fact be given for this. Some of course give verapamil, a drug, but again ECG changes will be there. One has got to be very careful about that. Then topiramate, another drug that has been tried, 25 milligrams per day up to maybe 100 milligrams per day can in fact be tried. So these are some of the medications for cluster headache, which occurs in clusters. So it is again a unilateral severe pain in and around the eye, and you will have a redness of that particular eye, conjunctiva, the nasal stuffiness, nasal congestion, as well as this may last in the bout for about 1 to 3 weeks, or sometimes with remissions it might go on even for a year. And that is what is cluster headache. So if a cluster headache occurs like that with these features, kindly see your physician, neurophysician and or neurosurgeon and investigate it accordingly, rule out any other organic causes, and then take the medications as advised. Thank you very much.